Thank you, everybody, for joining me for the Health and Wellness staff meeting from May 6, 2021. Please note this is a recording of the meeting that has occurred. So I'd just like to let you know what we're going to be discussing today. We'll talk a little bit about COVID and give you a little update. We'll discuss the occupational health and safety and how the Joint Health and Safety Committee works, the WSIB and injuries, and then changes within the Health and Wellness Department. And then we'll have time for general comments, statements, and questions. So in regards to our COVID update, I just want to let everybody know that working in more than one workplace is now allowed. As of April 23rd, 2020, the government lifted the restrictions of a one workplace rule. So this in mind, presentation manner does require you to let us know if you're going to be working in another workplace. And we also require that you let us know which workplace that you will be working at. And just to let you know, in the event of an outbreak in the other facility, you would not be able to continue working at presentation manner until the outbreak has been lifted and or resolved, and vice versa. So if presentation manner was to go into outbreak, you wouldn't be allowed to return to your other facility until the outbreak was lifted or resolved. Okay. In regards to vaccinations, they will now occur at presentation manner for both first and second doses. Toronto Public Health has allowed for homes to now start administering and vaccinating residents and staff. So at the moment, it stands that all staff members must wait the 16 weeks for the second dose. However, I did receive an email today, May 10th, in regards to lifting this length of time and allowing for nurses, PSWs, and essential caregivers to be vaccinated within a shorter period of time. I think this will help allow for staff to work in two places, as well as increase the safety of our residents by having the ECGs vaccinated fully. So just in general, I want you all to keep up the great work. You've done an amazing job over the past year. We're very proud of you. We're very proud of presentation manner and how we've gotten through COVID. So just keep up the great work. Now for occupational health and safety, presentation manner is invested in the health and safety of its employees. Protection of employees from injury or occupational disease is a major continuing objective. Presentation manner will make every effort to provide a safe, healthy work environment. All managers and workers must be dedicated to continuing the objective of reducing risk of injury. So those are taken directly from presentation manners policies. You can find this in the purple binder that is marked resident care. Sorry, the blue binder that is safety and emergency planning. So those are located on every floor of the assisted living units at the nursing station in the black cabinet. Occupational health and safety is a team effort, so every worker must protect his, her, or her own health and safety by working in compliance with safe work practices and procedures established at presentation manner. So that includes using Hoyer lifts. Hoyer lifts are a two-person task, and you must do this in a safe manner. IPAC practices, so that's infection protection control. So those are the mask wearings, the hand washings, wearing gowns when required, keeping social distancing. PPE, so when on isolation, making sure to follow the proper care, wearing the mask, the shield, the gowns, the gloves, and disposing of all disposables in the correct manner. COVID screening. So in regards to COVID screening, I just want to make sure that all staff is taking into consideration any sick spouse or partner or children within their household. It's important that when you're answering those screening questions, that you think about the people that you're surrounded by. Orca Modules is another place that you can get information from. So we have modules on injury prevention, safe lifting, fall prevention, not only for staff, but for residents as well. And I've just posted some of the signs that you might see around that have something to do with health and safety. So sanitize your hands, wash your hands, a wet floor, which could be slippery and lead to falls, maximum occupancy, so that's elevators and staff rooms and staff areas. I know it's difficult right now, but let's do our best to follow those maximum occupancy and physical distancing rules. With everybody using the one staff room, I know it's difficult, but if we are do our part in wearing a mask and washing hands and just do the best that we can. So Joint Health and Safety Committee, their duties involve workplace inspections, accountability, ensuring a safe workplace for all, and ensuring staff know who and when to report an injury. The members of the Joint Health and Safety Committee at presentation manner is myself for the Wellness Department, and I am the chair at the moment. Daniel for the heavy duty cleaning, Jose, Environmental Services, Debbie in Food Services, and Cassandra for Environmental Services. Now, in the event of an injury, you can report to any of these people, but it's important to report, okay? So here's a list of how to contact the department heads or the Joint Health and Safety Committee attendees. It's important to make note that these are posted in the staff room. So if you have any questions or concerns or an injury to report, the information is posted there, as well as you can see your department head or myself or a charge nurse on duty. So injuries, what to do. So what I did with this during the meeting is I asked what are the most common injuries that occur within our field as nurses and PSWs. So I know all of you are sitting there answering the question at the moment, and we're saying back pain, which you are correct, ankle pains or ankle injuries, wrist injuries, shoulder pain. We also had knee pain. So just a few injuries that are very common in our field. So all injuries must be reported immediately to management or the charge nurse. The charge nurse will then complete an incident report. If medical attention is required, we need to report to WSIB. At this time, charge nurses, just be note that you should be in touch with me, and I would go the step where I would be the one reporting to WSIB just to make a little easier for you and take some of that stress off. So this is a common sign that you will see around the building in any workplace. It's a WSIB poster. And in case of an injury or illness at work, the steps are 1, 2, 3, 4. So step 1 is get medical attention. So any of the nurses here, if it's a doctor's day, they can help. If you need to call 911, then you do that immediately. Number 2 is documentation. So you need to do your incident report. You need to report to the charge nurse. You need to document. If it's not documented, it didn't happen. Report to WSIB. If it's required where your injury requires healthcare, health services outside, and the injury could be a potential to be long-term, we need to report to WSIB. If you're going to lose wages, we need to report to WSIB. So that's when I get involved. Number 4 is work together. So the staff, charge nurse, management, we will all work together with WSIB in order to make sure that the best medical attention and healthcare is given to the employee or the injured person, and that there's as little bumps into getting whatever is required, whether it's monetary value or care. Okay, so we'll help in taking care of you. So these are the incident reports. I collaborated with Compass in order to make sure we had all the information that was required. So we remember it says right there that this form needs to be completed within 12 hours of the incident or accident. So say you feel like you strained yourself, but you're okay, but you wake up the next morning and you're not okay, you need to report that as soon as possible, okay? So we need the incident date, time, the person that was injured, their date of birth, phone number, and address. And we need all the details of the incident or accident that occurred. We need to know the injury time. Is the employee a housekeeper, a nurse, a PSW? Where the injury occurred? Was there any equipment or property damage? So something I can think here, like did the chair break and you fell and you hit your head? Or did the Hoyer lift, something happened with the Hoyer lift and you ended up hurting yourself because you had to strain to protect the resident? That kind of thing. Does your injury require you to go to the hospital to see a physician? Description of treatment. So for example, the other day, a PSW had bruised her hip and we applied an ice pack. So that's where we would put that information there. And if they go to the hospital or they see a physician, we would like the name of the person they saw. And if the associate provided a functional. So the functional form I've given to some staff already, that just allows us to see if there's any limitations or if it's safe for you to return to work. So those are important. And on that functional form, it would let us know if you required modified duties. And if you are required modified duties, we have a duty to offer those to you. And then lastly, the WSIB compensation form, if it needs to be completed, we need to mark that there, yes or no. And if it is, the date and time and who in the Joint Health and Safety Committee was notified. So for most of us, it would be myself and you would always report to me. And then lastly, we would want the injured person's name, their signature and date, and who completed the form. So the charge nurse or myself, the date, their position, and the department. And then any notes or instructions that were taken. Again, if you have any questions, you can email me or see me regarding that. So now we're just going to discuss some changes in the Health and Wellness Department. And this meeting is being recorded mostly for the night shift. So this part does affect you. So please feel free to send me any questions or come and see me regarding the questions. So at this moment, we're going to be changing all shifts to start at 7 to 3 and then 3 to 11. We're finding that when we have 6 to 2 shifts that we're having a hard time finding coverage for any sick calls. Not many people are willing to come in at that time. And then from 2 to 10, we have that period from 10 to 11 where the second floor seems to be really busy still, and they don't end up leaving until 10:30, or sometimes they even end up just staying till 11 anyways. So effective May 30th, we will be eliminating the 6 to 2 and the 2 to 10. So the duties that happen between 6 and 7, I've been working with the staff to find an easy way to shift some duties into the day shift and shift some duties into the night shift. So I've asked for some assignments to be given to me. I'm still waiting for one more night shift so that I can finalize how this will affect both day staff and night staff. So as soon as I receive that, we'll have some more discussions about this. So just to let you know as well, there'll be a rotation of assignments on evening and night shifts effective May 30th. So if you're moving from nights to evenings or evenings to nights, you are aware because we've already spoken about this. However, there will also be a huge shift on evening assignments. So those of you that work on 4th floor might go to 1st, those on 1st might go to 3rd or 2nd, and vice versa. So there will be a big rotation happening effective May 30th. That's the beginning of a new work week. And then also I would like to reduce the amount of overtime hours. I'm not saying that that's going to happen very quickly, but it is a goal, and I think it's been a goal for a really long time. If we can get your hours down to 88, I'd be happy. That being said, it won't be very quickly that that occurs. It will take some time. So just a few gentle reminders. Absolutely no earpods or headphones are allowed on the floor. I cannot reiterate that if there's something in your ear, you're not hearing what the residents need. You're not hearing what the nurses or other coworkers need. So absolutely no ear pods on the floor. Safety first. So no ear pods, no cell phones. It's going to be a cell phone free zone, okay? No ifs, ands, or buts about that, please. Save your phones for your breaks and before and after your shift. Okay, that's important. And at that time, you can sit down, relax with your phone, have a cup of coffee, and just chill. Okay. So please make sure you're communicating with your team members before leaving the floor. They need to be sure that someone's there to take over for you, as well as if there's any concerns or something that happened on the floor that you're aware of. Please also make sure all documentation is done before leaving. I've been going through the POC and we have big gaps from all shifts, days, evenings, nights, full-time, part-time, casual. I need that to stop. So we need to get on top of the documentation, and POC must be done before leaving, okay? Again, vacation requests, summer is coming. I think I've received 2, maybe 3 requests so far. So it's not that I don't want to give you your vacation, but I do need to keep in mind the needs of presentation manner. So if you are wanting vacation during the summer, please request it as soon as possible. Time off requests, I need these as soon as possible. Nobody has a schedule, a set schedule. The full and part-timers, sometimes some of them have been able to keep their consistency throughout COVID, but none of the part-timers or casuals have a set schedule, okay? The full-timers get their 10 or 11 shifts, and then whatever is left goes to the part-time and casual staff. So please keep this in mind, and when going forward, if you have an appointment or something scheduled, you need to let me know so I don't schedule you. Okay, thank you. So if you have any questions, as I said, I'm recording this, so you can please feel free to email me or make a send me an email and we can arrange for a time to meet. So some of the questions that I received during the 2 meetings that I had, one was sick calls. We are having way too many sick calls, and the nurses are asking a lot of staff for extensions. And some staff wanted to know why the staff that are off aren't called before asking for extensions. They're wanting us to share the extra hours. So again, I want you guys to keep in mind that sick calls are exhausting for the nurses. We probably get sometimes like 2 a shift, 3 a shift. It's very hard for the nurses to sit there and call through everybody every time someone gets sick. And another issue is that the staff don't always pick up the phone and return the calls. For example, I have called and left a message to a PSW, and to this day, I have not received a response. So in all fairness, when you call me, I call you back. So if I call you, it would be nice if you returned my call, even if it's to say that I can't work or I'm not available. You could always text and say, I'm not available to work. Is it important or is it regarding something else? So it's very time consuming for both nurses and myself to keep calling. So we have suggested that the nurses try sending a group text to all staff that is not working before offering the extensions to the staff that are on. And then the first person to respond would get the shift. If you have any questions about that, please let me know. Another question was, when the staff are called in and arrive late, can they be paid for the full shift? Going forward, yes, the shift will be paid in full. So for example, if you're called at 5:30 in the morning to start at 7 and you can't get there till 8 o'clock because of transportation or whatnot, then you would be paid from 7 to 3 and not 8 to 3. Okay? But please send me a quick note so I can be sure that your time card is corrected. When staff agree to work, another question, sorry, is that when staff agree to work extensions, they need to work their full assignment. They are often tired and the other staff end up picking up the slack. Again, if you're accepting an extension, please be prepared to cover the assignment fully. We also try to call people that are off in order to have a rested person working. So in general, if you accept the shift, please be prepared to work it and don't say yes. And then when it comes time to working, say, oh, I've been working all day. Can you do that? We really need you to pitch in and work as a team. Okay. So when being called to cover a shift, please do not ask what floor. It's not important. The nurses are often getting a question from the staff when they call them in, what floor is it for? Honestly, it doesn't matter. It does not matter what floor it's for. We work together, myself and the nurses, to assign people to the floor, and everybody has the capacity to do the work on any floor. So we all need to work together, okay? Some full-timers have an assigned floor, but some also float around. Part-times and casual staff are there to fill the gaps. So you should be able to go on any floor and work anytime. And if you need, please make notes so that you don't have to keep asking questions to the other staff. And there was a comment from one of the PSWs that they would prefer, please don't come to the floor and say, I don't know, or continue to ask what to do. Please remember, we're all providing care. You need to provide care. It doesn't matter what you know or what you don't know. You just need to provide the care. So pull up your sleeves, put on your running shoes, and let's just go work together as a team. I really liked the comment from one of the staff members. They said, we are there to work as a team, but we also have our own responsibilities. So working together is great when you have two-person assists, but after that, it's time to separate and do your own assignment and make sure all your work is done. Breaks. Please don't take them at the same time. If you are 2 or 3 people on the floor, you need to schedule your breaks separately from each other. If you take it together, then you have to be accepting the fact that it could be interrupted to go and give care. So in order to solve this, do not take your breaks at the same time. Everyone needs a break and time to eat. The same way we need to focus when we're feeding the residents is the same way we need to focus on ourselves. So please take a proper break and do not take breaks at the same time. So that concludes the meeting. If you have any additional questions or concerns, please email me or come and see me and we can talk about that, okay? So thank you very much for your time and hopefully we'll see you at the next meeting.